Greetings and welcome once again. This is Paul Hansen. I'm here in Pasadena with Dr. Dennis Buckley of the Health Advantage. Good afternoon.
Good afternoon, Paul.
How are you?
I'm doing fantastic.
Good. We're going to do a little recap. We're going to run through a few things here. Many of you have heard us talk a little bit about the Take Shape for Life program, about creating health in your lifetime. And we're just going to run through briefly what it is and what we're trying to accomplish here with as for our patients. This is directed towards health professionals, chiropractors in general. What we have is an optimal health system. It's a three-pronged approach to the obesity epidemic that we're facing in the country, and basically incorporates a Medifast portion control meal replacements, the Habits of Health system through with Dr. Wayne Anderson, and a health coach. The Habits of Health system is encompassed in Dr. A's books, The Habits of Health and Living a Longer, Healthier Life. This is the core of the health program and really gives the client, the patient, a good understanding of how they can take control back of their health. Right?
Yes, and these habits fit right in with what we call the chiropractic lifestyle of addressing all the foundations of health: nutrition, exercise, sleep, nerve function, and also the habits that people have in their lives that they can put in place to support those four areas.
Yeah. Excellent. And the part of this, and a real big part of this, is the personal coaching for weight management and overall health. Just a quick example here. Here's a cardiovascular surgeon, and you've commented on this before. Now, his stomach was getting in the way of his lifestyle.
It's getting in the way of him doing surgery. But you know, if you were going to look at someone who is the example of what not to be, that would be him. But of course, with this program here, in less than 6 months, 8 months, he lost 164 pounds. He went from the warning to the example.
Yep, absolutely. Here's another lady. This is a remarkable example. In height of her obesity, she was 258 pounds back in 2002. She's maintained this weight since March 2003, for 10 years now, almost 10 years, 128 pounds. It's a remarkable story. And it's because of Take Shape for Life and the Habits of Health system.
There's a lot of examples out there of people that have lost weight.
Yes.
But there's too few examples of people that have kept it off.
That's exactly right. So why Take Shape for Life? Why the focus on weight management, weight control? Well, here's why. We have a national crisis in this country. This timeline, you will see through the progression of these slides, starting in 1988, and you'll see some of these states didn't have any data, and it goes from white with no data up to red for over 30% obesity. In this short period of time, from 1988 to 1998, look what happened, to 2008, to 2010, and it's even worse today. It is one of those, it's a scary trend, isn't it?
Yes, because the complications from obesity and the cost and mortality and morbidity will exceed all other diseases combined.
That's right. Here's an example. This is from the Cleveland Clinic on weight loss and how many literally life-threatening diseases are corrected simply by getting to an optimal weight.
And most of these problems on this list are lifestyle caused.
Yep.
If you look at the average about the risk reduction, it goes on average about 70% reduction just by getting to an ideal weight. All these problems can be resolved. And this falls right in line with national guidelines that show that about 70% of the problems people go to doctors for are lifestyle related. And if you look at other studies, and a lot of it is that they say, well, no, this is DNA, this is your genes that cause this. Well, it's only about 10% probably. Most of it is lifestyle.
And here's the thing, two little boxes down there at the bottom of the slide. Quality of life improved, 95% of the patients that were in their study. And mortality, 89% reduction in a 5-year mortality rate. So definitely the proof is in for sure. Our current health system is a system that just simply reacts to disease. We treat symptoms, not root causes. It literally discouraged patients from taking an active role, and it's become, circumstance versus personal responsibility.
But there's a lot of money to be made by getting people to understand or getting people to believe that they are victims, that they are experiencing their genes and they need drugs. There's nothing they can do, and that is permeated every day on TV with commercials.
Yeah, absolutely. And here's how our allopathic medical care system is taking care of it with drug treatment.
Right.
And it's a continuum, and people, they get attached to their drugs and they think that is their path to health, where it's really the path to disease. So we've expressed this before. Diets alone don't work, and I think everybody knows that 85% of the people who lose weight gain it back within 2 years, and then additional weight. Yeah. There's really no medications, diets, or dietary supplements that themselves have ever succeeded long term. And we all hear ads on TV, radio, the newest drug, the newest this, the newest that. The fact of the matter is there's no magic bullet out there. Can we help patients get healthy? Yes. Here, this is from Danziger, Journal of American Medicine. Now, you've seen this in your patients.
Yes. One of the biggest problems you see when people who know they need to make changes in areas of their life, such as diet and exercise, is that usually there's a psychological and a logistical barrier. One, logistical, I don't have time. I don't have the money. I don't have the resources.
Or I travel a lot.
I travel a lot. I work. I have kids, whatever. And this is all true. And there's also psychological barriers about I can't, and people get very attached to their diagnosis. And I can't because I was told this, and I can't be the only thing that I'm unable to. So the psychological and logistical barriers need to be overcome. And one of the nice things about the Take Shape for Life program is it has done that, has made it very, very simple, and it's helped people to really become resourceful when they appear to lack resources.
Yep. We say that we got the solution with Take Shape for Life, and the reason why we say that is because our programs are time-tested and proven. Bloomberg School of Health uses this. The National Institute of Health uses it. John Hopkins, Bloomberg, yeah. All the clinicals are done there. So in 32 years in business, rock solid history behind them. Success rates are significantly higher than anything else out there. We focus on solutions for optimal health. And really the key to this program's success has been the health coach. We help your patients to get to a healthy weight. 2 phases. 1, get to a healthy weight, which means a 24 BMI or better, and phase 2, living the habits of health system. Here's where it starts, right?
Right.
This is what you would do if a patient comes into your office, right, Doctor?
This is what we do. This is one of the things called a client tracking sheet. It's a health profile, and have them fill this out. And this gives us an idea about where they're at. We give them an idea where they're at mentally and also physiologically, because there are very few contraindications to this program. But even if they're have some special needs, those can be adapted for. So A, where they're starting, B, where they're aiming to go to. So you as the provider, or in this case the health coach, can able to design the safest program that will get them there the quickest and the most effective. And one of the things about the health coach, many people left to their own devices will not discipline themselves very well.
Yep.
Having a coach or someone holding you accountable will get more out of you than you'll get out of yourself.
Absolutely.
And that's one of the things, if you look at some of the top athletes, performers in the world, whether it be the playground, the boardroom, the stadium, whatever, one of the keys to a lot of people's great success is having a coach. Have a coach.
Yeah,
So,
absolutely. And that's an excellent point, because I think people kind of gloss over that. Why do I need a coach? Well,
Not working for you on
Yeah.
your own.
I mean, if you want to get to an optimal performance level in anything, as you just pointed out, you seek a coach. You seek a coach. So what is this, what we're talking about? Well, the core of the program is our 5-in-1 program. And basically what it is, there's well over 70 meals. I think there's over 80 meals now. They're all portion controlled, high quality food, which balances fats, carbs, and protein, and with adequate protein to protect muscle. There's no stimulants or drugs. It's convenient. It's what we say, it's goof proof, and it's easy for anybody with any lifestyle to utilize this program, right? And you've seen that with your patients, right?
Yes, and myself.
Yeah. So, and it's cost neutral. Now, for me, you know, I was working in an office a lot, and I lost 21 pounds in 6 weeks, and it saved me money, you know, because I didn't have to go out and eat lunches out. I mean, I save money.
It adds up fast.
It does. It does. They're low calorie meals. We get you to eat every 2.5 to 3 hours. You're not hungry, and the patients, yourself or whoever's going to go on the program, going to lose 2 to 5 pounds on average the first.
And this is one of the logistical barriers. People say, how am I supposed to eat every 2.5 to 3 hours? I don't have time to do that. With this program, with the shakes and the bars alone, it's easy
the grab and goes,
to get a meal in right away.
Yep, absolutely. And then you combine that with one lean and green. You may have that in the evening. You may have it at lunch on a business appointment. Whatever it is, high quality protein, low fat protein with 2 servings of vegetables, low glycemic vegetables. And then the MetaFast meals, let's talk a little bit about them. Why are they effective? Well, they've been studied so long. We actually get you to lose weight faster than any other program out there. It's low calorie with adequate protein, and we do that because we want to protect the muscle.
And you know something, one question people ask, how do they taste?
Yes.
I'm telling you, they actually taste really, really good. Some of my favorite things.
Yeah, absolutely. Brownies, that soft serve, pancakes.
The chocolate shakes, Maryland crab shake, Maryland crab soup.
Yeah, it's
Yeah,
really
I'm telling you,
good.
it's good
Really
stuff.
good. So when you start the program, the patient, client, they get a quick start guide, and it's literally as easy as ABC. Read this, they'll understand it. They got questions, they're going to come back to you and ask, but it's really that simple. And along with that, here's the core of the program. It's Dr. Anderson's Habits of Health Blueprint, his book, The Habits of Health, and the companion guide, which is kind of the workbook to that, the Habits of Health, living a longer, healthier life. We get them into that. That's the core of the program. There's their education, and where they can learn how they can take control of this and move this and sustain it for the rest of their life. So we want to talk to you today, and one of the reasons why I'm here with Dr. Buckley is we want to talk to you about implementing this service into your practice and enhancing your bottom line. So the benefits to your practice. Now you've seen some of the benefits, right, Dr. Buckley? And how does this fit, with what you've seen so far with the chiropractic service?
If you look at a lot of the underlying cause of why people come in, okay, let's just say, for example, for back pain, neck pain, joint pain, one of the problems or cofactors is most people are overweight. They need to lose weight.
Yep.
And because they're overweight, they're not very active.
Yep.
Okay? One of the reasons they're not active is they're overweight.
That's right.
So it's kind of like,
hand in
so what
hand.
happens is, as I'm trying to address the underlying causes of why people are having these problems, one of the problems is them being overweight. So the solution is to get them to their adequate weight. Well, one of the things is people are looking for this. The weight loss industry is a multi-billion-dollar business. People are spending money on this. Unfortunately, on bad products, are looking for shortcuts.
They get, the diet industry, that brings up a sore point. They have really manipulated a lot of people into coming back, because they're not learning how to progress.
Yeah. So one of the things that we're trying to do is basically, how do we improve our results with our patients?
Yeah.
How do we get people, how do we become a one-stop shop to really address the underlying cause disease. Well, one of the things that happens with this is it provides a value-added service. It provides an income stream. It also results in referrals because of the fact that it really ties in. This program ties in so well with the chiropractic lifestyle of basically teaching people self-responsibility, teaching people how to take better care of themselves, teaching people where true health comes from, designing a true health plan for them, not just a crisis plan, which most people have with their Kaisers and their Aetnas and their Blue Crosses, but also it basically creates for everybody a better way of living. And it really reflects well on your clinic that you really do care about
Overall.
taking care of people long term by teaching them how to take care of themselves, not being so reliant on going to the chiropractor for every ache and pain. And like you talked about, the diet industry is like, oh yeah, well, you know, you need this and it's going to cost extra money. What you talked about before was basically this becomes a cost neutral. People are already spending money on food. What they're going to be doing now is spending less money on better food, eating healthier, losing weight, reducing cost, reducing infirmary, reducing time down, increasing their enjoyment, and enhancing your practice.
It all adds up. It all adds up. And then here's another point. We can produce an income source not controlled by management.
Oh, yeah. Yeah.
Okay. That's a biggie.
That's right. Because one of the things is now in practices, because of diminishing reimbursement rates across the board for all providers, you know, you need some type of income because our cost of doing business has not gone down. In fact, it's gone up.
Yeah.
So you need to basically augment your practice with an income source that directly ties into what you're trying to do. So this is a natural fit. It fits well, and people really appreciate it.
Yeah, excellent. So the other thing is, with Take Shape for Life, you can actually create a competitive advantage. You're going to be able to offer personalized service that's not easily duplicated by competition. It certainly builds patient loyalty, and I think you've seen that. You know, people get results, they love it, and you've got walking billboards out there for yourself.
That's
right. It accommodates patients looking for non-drug solutions, and there's plenty of them out there right now. And it promotes healthcare versus sick care, which is what we're all about. And it develops advocates for your practice. You can literally create a substantial profit center, significantly add additional income into the 5 figures plus. And the other cool thing here is no inventory.
Not selling it.
Yeah, you don't. I mean, you are basically prescribing this as their health path, right? It should be that simple. The startup cost to get into the program as a health professional is $199, and you've got repeat income potential. We basically have 2 business strategies. The single practice, which is patient focused, of course, and then we've got an expansion model where you would be patient and health coach focused, and we'll talk a little bit about that. Strategy 1 is patient focused, which is where most people are going to start. With your private practice, you're going to earn 20 to 35% on clients' orders from Take Shape for Life. And then within the first 30 days, there's also a client acquisition bonus. And then there's also patient retention bonuses that range from $250 to $1,000 that are paid every 3 months. This is how the compliance fees work. An escalating scale that goes from 20% up to 35% based on the dollar amount of orders that go in on a monthly basis. Now, at the top level at 35%, yeah, generally it's going to be 21 to 25 patients that are going to be on the program, on the 5-in-1 program. Their normal order is going to range between $250 to $300 a month. Okay. Here's a hypothetical example. If we have 50 patients ordering on an average of 250, we kind of do the low end of the average orders, would produce 12.5 in orders, 35% commissions, $43.75 gross monthly income. Comes out over $50,000 a year. Now that's a pretty significant increase in income right there. Right?
I bet.
Yeah, $56,000 total yearly. If we double that, go to 100 patients, you can see we're with bonuses, we're well up into the six figures. So the other thing is, what does this look like through the eyes of your patient? Okay. Well, we have point of service brochures. We've got professional quality wall brochures, wall flyers, handouts that people can get information at their fingertips and take with them and learn about the program, as well as from you, the professional, guiding them to this program, going over some of the information with the patient, and then helping them place their first order. And it's as simple as that. And from that point on, they will get their meals sent directly to them. And that's a big thing. And there's nothing for you to stock or inventory.
And the client can then after that modify and order their own. You don't have to do it for them.
Yep.
And so basically you're there as the resource. You're a coach helping them with questions and helping them with the challenges that may come up. And also, a little bit of time to kind of hold them accountable. And if they're active patients in your practice, you'll be able to act with them, actually walk them back there and weigh them.
Yeah, exactly.
And so we get a real number.
Bring them in for, one of our doctors calls it celebration day. When they come in, they do, get them in on a weekly basis and throw them on the scale.
And I do other things too. I actually check their blood pressure.
It's a good idea.
Talk to them, ask them about the tertiary benefits. How you sleeping? How do you feel? Has anybody said anything to you? They go, well, yeah, I've had people say things to me about, did you cut your hair? She lose weight.
Yeah. And then we gradually get them into an exercise walking program. Generally, depending on how much weight they've got to lose, we don't have them start off with too much exercise because we want to get them to adapt it to the program first and then increase the activity level. And here's what you had mentioned, getting a weigh-in day, a celebration day. And then from that point on, they simply go online and they order whatever they want to order to stay on the program. And then you're going to have examples like this where they're going to be talking about it and producing referrals for your practice. So let's talk a little bit beyond your practice. As a health coach, you're acquiring clients, and to move beyond that, we're moving to business coach and business leader. Income will follow the skill sets and the actions. In the two business strategies, patient and health coach focus, let's look at the strategy 2 just briefly, where here what you're going to see as an outcome of proper coaching, a healthy client's going to become a referral advocate for you. And there's also potential that they would like to pay it forward to become a health coach. We have a certification program where that can take place through Dr. Anderson's Habits of Health certification for lay people like myself. Okay, my wife and I are certified health coaches for Take Shape for Life. The money side of this is our income disclosure statement. Now, why do we have to disclose this? Well, because we're a publicly owned company and on the New York Stock Exchange. The highlight you see through there, the ED, or it stands for Executive Director, these are average incomes. You see the high of 11,000 to the average of almost $3,400 a month as an Executive Director. Executive Director is basically someone who's doing at least $6,000 a month in volume. That would be your average income for this. Now this goes through June of 2011. I got to say these averages have bumped up since that period of time. Take Shape for Life as a whole, as a business, has actually escalated through the recession. Has been one of those bright spots in the economy.
Well, that's the thing. That's the funny thing is it's kind of a
it's a reverse trend.
In the movie Top Gun, Tom Cruise says we have a target-rich environment. So the good news is that we have a target-rich environment with a lot of overweight people, which is a sad state of being. But on the other hand, this gives you something to help maybe reverse that trend.
That's exactly right. Let's just this is just a look at incomes, annualized incomes for some of the leaders in our business. Now it starts off here with senior coach. Well, we've got average senior coaches of making $5,000 a year. Now you say, well, that's not a lot of money, but you know, if you have a job, how many people just got a $5,000 annual raise? Not many.
They wouldn't kick that up.
That's right, exactly right. But the people that do the work actually make the money, and as you'll see, you can ratchet it up to whatever scale you wish. Here's our growth through 2010. Yes, this is the graph's a little bit old, but we're you see the growth trend there. Even through the huge downturn that started in 2008, we went the opposite direction.
Okay.
As you said, we've got a target-rich environment. It's $65 billion industry. That little red sliver that you see there that says 0.25%, that's our portion of the industry right now. So we've got a lot of growth that we can capture. And why do we say it? Because, well, we really have a perfect storm. We've got an economic crisis and we've got a health crisis in the United States. And we pointed to that many times. I mean, our unemployment rate right now in California is 10% or over. And I think the real unemployment rate is probably more like 15 or higher.
Possibly.
Yeah. So a lot of people looking for answers. They're looking for answers economically and health-wise. So how do you get started? So we have a turnkey operation that allows you to get into this process real simple. We set up your office for you. My wife and myself go and actually assist you with that, like we have with Dr. Buckley. We'll be happy to answer any questions that you have regarding that. You'll get a personalized website. You get client and patient management that's included, and minimal training and very little time involvement. Wouldn't you say?
That's minimal.
Yeah.
In fact, but of course, the more you see a need for this in your patients, the more you address it,
right,
and the more you make it part and parcel as a system of your office. All of a sudden, you have lots of people on this, and it really is. You talk more with them about the results they're getting and their excitement, and like most of the people, that what happens is they become advocates, and that's where you get your referrals from.
Yeah, exactly. So, questions? Yes, you'll probably have some questions. We certainly invite them from you. We'll leave some contact information here at the end, so feel free to contact us as you see fit. We'd love to have a personal meeting with you, answer any questions that you might have, and we invite you to get started with us. Any other last comments?
It's a perfect opportunity right now to really address needs in the community of health, wellness, longevity, and guess what? A lot of times taking advantage of opportunities results in you looking at something critically and objectively and say, does this fit in with what I'm going to do? Too many people, I think, have tried to create secondary income streams in areas that they're not passionate about or they know nothing about. Okay, this fits in so well with the chiropractic lifestyle, a chiropractic mindset, that if you're already a chiropractor or a healthcare practitioner that really wants to look at solutions, this is a natural fit and can really enhance your practice. One of the things I recommend is that you go on the program yourself. I'm sure most of you can stand to lose a few pounds out there. I was able to, but go on the program yourself and experience it. Therefore, you will come from a place of knowing instead of about knowing about. You'll know about what this program can do, and you'll be able to share that with your clients.
Excellent. Well, once again, thanks. This has been great. Appreciate the input here today, Dr. Buckley. And to all of you out there, give us a call. Join us. We look forward to hearing from you. Thanks. Bye.